Good morning. I am here at Regenexx Cayman Islands getting stem cells injected into my spine. Today is August 25th, 2022. I came in last Monday and got my bone marrow aspiration and blood draw. And then I came back this morning and got another blood draw for them to combine this blood with the cells as a vessel to re-inject them into my spine. And Regenexx Cayman, you can only is one of the locations you can do cultured stem cells. So it's a short culture, 10 days for them to grow into larger quantities. And it's something you can't do in the U.S., so that's why you come to this tropical island to get it done. And I'll be posting video updates on how the progress is for my chronic lower back, mid-back pain. And just kind of go through the process and share it with you guys. Thank you. Here are some photos showing the locations of the stem cell injections. The facet joints connect the vertebrae on the back. The discs are between two vertebrae on the front. When the disc is compressed and bulging, the facet joints take more pressure on the back end, which leads to facet degeneration. And I have facet degeneration at multiple levels. They injected the facet joints at each level. They did the discs, the 4 disc levels, as well as additional levels in my thoracic spine. Here's a lateral view of the spine. You can see the L1 stands for your first lumbar bone vertebrae, L2 vertebrae, L3 vertebrae, L4 vertebrae, L5 vertebrae, and your S1 is the top of your sacrum. Those are all connected by the white discs between each of the vertebrae connecting them on the front. You'll see the bottom one is the L5S1 disc between the L5 and the sacrum, and that's one of the levels where I had stem cells injected into my disc. To the right, which is behind, is the spinal cord, the light brown cord, and just behind that is the epidural space. You see the needle in the bottom middle that's showing an L5S1 epidural injection. Stem cells were injected into that L5S1 disc, as well as that epidural space, as well as the facet joints at that level. And they also did some of the ligaments at that level. Here is a photo showcasing the rib facets, which were targeted at the T6 to T12 levels in the thoracic spine. The top middle, you can see it says spinous process. If you touch your back in the middle, you'll feel those bones. That's the spinous process you're touching. On the left side, you can see transverse process. There's one on the left and one on the right. And on the right one, you can see the circle there. That's where it connects to your rib, and that's your rib facet. You have those on the left and the right, and those were targeted between T6 and T12 as well, as I have pain that stems out to my rib cage. Here's a zoomed in lateral view again. It's showing the L3 vertebrae, the L4 vertebrae, and the discs are between it. When they are white, they're hydrated, and you can see they are not pushed out to the front or the back, no bulges. Just behind is the yellow is the spinal cord, and just behind that is the epidural space. Again, just another zoomed in photo. This photo shows more muscles than it does bones here. You can see circled here is your external oblique, which connects to the bottom of your rib cage and the top of your iliac crest, the hip bone. This shows the right side. On my left side, I get a lot of pain in that area. So they were going to target a couple of injections in the connecting ligaments to your external oblique. This is my lumbar MRI. You can see the bottom red circle is my L5S1 disc. It is bulging to the left, which is anterior out the front, and to the right, posterior out the back. It is much shorter, a loss of disc height compared to the lighter colored discs above it. So that disc was injected, as well as the epidural space there and the corresponding facet joints and some ligaments. The top 2 red circles, the top red circle is the T11T12 disc, and the second from the top is the T12L1 disc. Both of those discs are bulging to the right out the back, and you can see that they're darker, so they're dehydrated, loss of disc height as well. The vertebrae between those top two red circles is the T12 bone, and it's wedge-shaped. It's shorter on the front than the back, which has led to a lot less space on the backside, which is kind of aided in causing the bulges posterior at the back. So those discs were injected, as well as the epidural space at those levels and the facet joints at those levels. Here is my thoracic MRI. You can see the bottom two are the same, the T11, T12, and T12L1. Both MRIs would show those discs kind of at the junction between the lumbar and thoracic. Just gives you another view of those ones, as well as the upper red circle is my T6T7 disc. It's not as severe as the other three disc bulges, but it is a 3 to 4 millimeter posterior disc bulge, and it comes into contact with the thecal sac, and I do get pain and symptoms between my shoulder blades and below that area. So it was just while we were at the Cayman Islands to target that disc and epidural space and corresponding facets as well. And from that top one to the middle ones, they did the ribcage facets and facet joints at those levels as well. Here's a photo from the procedure. You can see the top photo, the black line on the right coming in is the needle in between the T12 and L1 disc. So it's image guided just to show the precise injections. The bottom's the same injection, just a different angle, but you cannot see it as well. And then the next photo they're going to show is another photo of the injection. The bottom one from the right there is the needle, the black line coming in, and that's between my L5 vertebrae on the top and then the sacrum on the bottom, my L5S1 disc. You can see my pelvis to the left and the right there. Just for visual aid, here is my photo after the injections. So you can see all of the bandages, the many different locations that were injected. And if you zoom in, near the upper bandage is kind of near my T6T7 disc injection. But if you zoom in, you can see there's also other pinholes that don't have bandages kind of up in that area on the left side, where that wasn't bleeding, that they did not bandage. But there was a lot of injections. The way bottom is a bandage coming up out of my shorts, which is my sacrum. My left SI joint was also injected. And then you can see the bottom white bandage is my L5S1. And then a lot in the middle there is the T11, T12, T12L1. The facet joints, just a lot of different locations while we were there to try to get the most bang for our buck and try to get some change from this. All right, so I just finished the procedure at Regenexx Cayman Islands. Between that blood draw video that we had about a 3-hour break so that they could go and mix the blood and prepare the cells. We returned and they did a conscious sedation to prepare you for the treatment. And then they brought you in the exam room and prepared you, cleaned off your back and just prepared the cells, got the x-ray expert in there to just show exactly where they're going to be injecting the cells. And it was about an hour and a half for them to actually go through with the procedure because there was a lot of locations that they went through. The L5S1 disc, the T11T12 disc, the T12L1 disc, the T6T7 disc. At all those disc levels, they also did the corresponding epidural space and facet joints. And then they also did my left SI sacroiliac joint and my rib facets from my T6 down to T12, as well as some of the corresponding spinal facets in that area. And they also did some of my ligaments that work off of my T12 rib cage into the area where I get a lot of lower left back pain. After all of that, they recommended that I get an LSO lumbar spine brace, and that's here, so I'll be wearing that 24/7. Right now I'm very sore from all of the injections. The conscious sedation has worn off, and I have muscle relaxers and pain pills that they've prescribed for me to take over the next few days. But overall, I'm very happy and excited to have the procedure done. I am optimistic that it'll work, and I will just continue to make videos to update you guys on the progress and how things go. Thank you.